I have a number of patients I take care of who are probably in that category of patients who received pembrolizumab alone, who are probably not going to recur. So they have, no evidence of disease, and they've been on it for several years. It's really incredible to see. That is not how it was. I'm really excited for a number of trials that are going to start to read out, and we'll get some reports on them at the World Conference of Lung Cancer later this month. The first is on CodeBreak 100, and that's with using the KRAS inhibitor sotorasib. And so KRAS has been a known oncogenic driver in lung cancer for 40 plus years, and for about the same amount of time, people have been trying to design drugs that inhibit the KRAS mutation that's found in about 12 to 13% of patients, especially those with adenocarcinoma. And so a number of KRAS inhibitors have come into trials and are being used in clinical trials right now. And it's very exciting because it appears we're starting to get signals of efficacy from these drugs, even in the phase 1 reports. And so what's coming up at the World Conference of Lung Cancer is the phase 2 data with sotorasib is going to be coming out, which will give us a better idea of response rate, how long patients respond on this inhibitor, as well as some of the side effects or adverse events that are being seen with this drug. The other trial that I'm really excited about is the report from LCMC3. And so LCMC3 is a large lung cancer consortium where they gave atezolizumab, so that's a PD-L1 inhibitor, to patients before they had their lung cancer resected. So the hypothesis was giving immunotherapy before surgically resecting lung tumors will help patients do better. The hope is that the immune system can be activated to start eliminating some of those cancer cells. And I'm really excited about this trial because I think neoadjuvant or before surgery immunotherapy, whether alone or in combination with chemotherapy, is really going to be the next breakthrough for our patients with lung cancer. And I'm hopeful that this will result in more cures of patients up front so that we have fewer patients who recur with metastatic disease. And so LCMC3 is going to report out their primary analysis of outcomes as well as outcomes as well as safety. Yes, and it's exciting to see all of these therapies that were new to all of us not that long ago really make these leaps further into curative intent therapy.
Yes.
Right now in the United States, we use durvalumab. So if patients have unresectable stage 3 lung cancer, they get concurrent chemotherapy and radiation therapy. And then we give them a PD-L1 inhibitor, durvalumab, for a year. And that has also significantly increased cure rates for that population of patients. So hopefully moving it to even earlier stages, so where patients are able to have their cancer resected, this will result in even better outcomes.